No matter what happens to President Obama's health care reforms after the November elections, the disjointed, costly American health care system must find ways to slow the rate of spending while delivering quality care. There is widespread pessimism that anything much can be achieved quickly, but innovative solutions are emerging in unexpected places. A healthcare system owned and managed by Alaska's native people has achieved astonishing results in improving the health of the enrollees who, while cutting the costs of treating them, have improved their health. At a recent conference, the health leaders from the United States and abroad at the native-owned South Edition in Anchorage, the Alaskans described techniques that could be adopted by almost any benefit healthcare organization willing to transform its culture. Such an information would require upfront financing for training, data processing, and the like, but the investment should rapidly pay off in reduced costs. The foundation, established in 1982, provides primary patient, outpatient care to Alaskan natives and American Indians who had previously been the responsibility of the federal government's Indian Health Service. It serves 45,000 employees in the American Anchorage area and 10,000 more scattered in remote villages, most reachable only by air, on an annual budget of $200 million. It only jointly owns and manages with a consortium of native tribes a small hospital and has built a modern campus of outpatient clinics with the help of loans, grants, bonds, and retained earnings and the like. About 65% of its revenue comes in what amounts to an annual block grant from the Indian Health Service, a source unavailable to most health systems. Another 45% comes from Medicaid, Medicare, and private insurers, and the rest from philanthropic grants. As the Commerce Department noted when it gave South Central a National Quality Award in 2011, known as the Malcolm Baldrige Award, the foundation has achieved startling efficiencies. Emergency room use has been reduced by 50%, hospital admissions by 53%, specialty care visits by 65%, and visits to primary care doctors by 36%. These efficiencies, in turn, have clearly saved money. Between 2004 and 2009, South Central's annual per capita spending on hospital services grew by a tiny 7%, and its spending on primary care, which picked up the slack by 80%. Still well below the 40% increase posted in a national index issued by the Medical Group Management Association. Patients have not been shortchanged. In fact, care and access to services have been improved greatly. Patients are virtually guaranteed a doctor's appointment on the day they request it, and their calls are answered quickly, usually within 30 seconds. The percentage of children receiving high quality care for asthma has declined somewhat from 35% and then went up to 85%. The percentage of infants receiving needed immunization by age 2 has risen above 90%. The percentage of diabetes with blood sugar under control makes it the top 10 percentile of a standard national benchmark, and consumer and employee satisfaction rates top 90%. The staff is in training to treat patients courteously, not with the disdain often reserved for the poor or ethnic minorities. The atmosphere is so welcoming that natives routinely congregate in waiting areas to swap stories and meet old friends when they do not need medical care. Although South Central has unique attributes, it even refers cases to traditional tribal healers if doctors agree. Here are some of the techniques that almost any healthcare system can adopt. Assigning small teams consisting of a doctor, a nurse, and various medical, behavioral, and administrative personnel to be responsible for groups of 1,400 or so patients. The team members sit in the same small work area and communicate easily. When a patient calls, the nurse decides whether a face-to-face visit with his doctor or other healthcare provider is required, or whether counseling by phone is sufficient. I can just tell when it's getting dark out.